We'll talk about risk, okay? And I feel like the risk of the procedure, when I look at all the possible risks, and having done it, I know where the pitfalls could be for the cardiologist. I think the number one risk is still that the patient may not respond. I would hate to schedule the patient for a procedure and not have a good response. So that you would have put the patient through the procedure without getting some benefit. So I feel like that's going to be the most risk for me. When I take a patient in, you can count on the fact that I'm going to think about the patient very carefully. I think every patient deserves that careful consideration to see if the procedure is the right one for them. I don't think every patient with hypertension should get this procedure. I don't think so. I think you have to select the patient very carefully, especially in the early stage of the procedure. Of course, the other risk could be damage to the kidney artery. I can see how that could happen. I haven't done the procedure using wires and stuff like that. Pain is a problem for this because it's kind of like having a kidney stone. It hurts that bad. But we, for Rosa, we devised a very delicate way of preventing her pain even before her procedure. So that's why she has no pain during the procedure. Patient selection, like I said, is super important. And also, doctor selection. There's a lot of doctors from different specialties out there that are interested in doing this because they have a lot of patients with hypertension and they want to be able to help the patients themselves. I think that's very understandable. But my thoughts, having done this, is that number one, I feel like the patient really should be an interventional cardiologist because of the different wires that we need to use to get to the kidney arteries. There's no one better than an interventional cardiologist to do this. And I'm not just saying that to promote myself. I'm saying that to give you my honest thoughts so that the procedure can be safely done out there. So I really feel that only an interventional cardiologist should do this. And I'm not going to mention that I'm actually interventional cardiology, so I won't mention that. Number two is I think it's just as important for that interventional cardiologist to also have experience and skills at what we call peripheral intervention, meaning not just fixing the heart, but also cardiologists who can fix the kidney arteries, the legs, and stuff like that, because that's just a different sub-skill set of interventional cardiology. I think that's really important too, because if you accidentally, heaven forbid, damage the kidney artery, you gotta be able to fix that immediately. And if you're not an interventional cardiologist with peripheral skill set, you won't be able to do that. And time is of the essence. You can't just wait and call someone to help you. By then it's too late, the kidney's dead. So I emphasize, I think that it's best to have an interventional cardiologist who has peripheral skills. Now, the electrophysiologists out there would probably call me and start saying bad things about me, but that's my honest opinion. So, it's good to be OCD because you want to get to all the arteries. You don't want just to cut corners because you can bring a patient in and ablate one of the 5 sub-arteries and call it an ablation. But the patient will get drastically different results if you ablate all 5. And you can see how being OCD is actually really, really beneficial for your patient. And I'm not going to mention that I have a little bit OCD in me. I won't mention that. And I thought about, do you need to be good looking? I think it's optional. So I think, it's nice. But I think it's optional. And I'm not going to mention that I am known as the best looking cardiologist. All right, and so I would like to close out the presentation by again thanking everyone in the audience for putting up with me to talk about this very boring topic. I would also like to thank Temecula Valley Hospital for supporting me through the years, for allowing me to bring these procedures to the hospital for my patients. And I'd like to give credit to the whole team. I'm going to name all of them because they all deserve recognition. So from left to right, I got Sarah, Mike in the back, Matt, forget about the guy in the middle, Heidi in the back, Dr. Joshi, she's training to be a cardiologist, Irina, Harrison, and Amy. So really amazing team, and without them, I don't think I would be successful. So thank you, the team, and thank you, everyone.